We need to have outcome-based treatment of the chronic diseases. There are people, as we know, that suffer from diseases such as cancer, heart disease, diabetes, etc. 5 major diseases, asthma, that consume 75% of America's healthcare costs. So, give the healthcare provider a year's worth of pay and say, take care of that patient for a year, and then if that patient is well at the end of it, reward. Not a payment for every test, every procedure, every doctor visit, every aspect of it, which causes the cost to mount up and mount up. And by the way, medical malpractice reform has got to be part of any solution. Ask any physician how often they have to practice, quote, defensive medicine because of their fear of a lawsuit, not because they think that it will improve the health of the patient that they are treating. So outcome-based treatment. Another one is a program that has been in a status that has been allowed in a couple of states, but has not been widespread, and that's called cash and counseling. In other words, if you are a senior citizen, they will give you the money every month so that you can spend that on how you think or best meets your needs. Now, obviously, the blowback to what that was, well, they don't have the judgment or the information, etc., etc. That's turned out not to be true. It's turned out to be true that when elderly patients receive this money, they are the wisest, and they consult friends, relatives, advisors, etc. That has had a dramatic drop in costs for the elderly. Another is encouragement of the most warm and beneficial setting for a person who's aging, which is home health care. The longer someone can remain in the setting, the warmth and love of their home, the better off they are. Now, we in Arizona, in our Access program, encourage providers to keep people in a home health care setting rather than institutionalized care. And they have responded. And we have as many as 3 times the number of people who are in long-term care settings, in other words, are remaining at home, than in the state of Pennsylvania and other states. So we should, and by the way, it's much less expensive. But most importantly, the environment of being able to remain at home for as long as possible is beneficial so much to the individual for the obvious reasons. There's many other aspects of this issue we need to discuss. But let me just finally end up with this. As we know, right now we have an employer-based system where the employer provides the insurance to the employee. Unfortunately, that's not the case with small businesses. And unfortunately, as health insurance costs go up and up, fewer and fewer companies and corporations are able to afford it. But the point is that when you are an employee and that employer provides you with the insurance, you don't have any choice. You either take that policy, or sometimes the employer may give you a choice of 2 or 3. But generally speaking, you don't have choice. Our proposal is to give every family in America a $5,000 refundable tax credit, and they take that tax credit and that money, a refundable tax credit, to go across state lines, to go any place in America, and go online and pick out the insurance policy they want, notify the government, and that health insurer will be provided. And if you have money left over, now if you want to stay in the employer-based insurance program, fine, you can. But if you want to have a $5,000 refundable tax credit and take it all over any place you want to and purchase that insurance, then do it. Now, some will say, well, the cost of health insurance is higher than that. Well, for people, then if you don't think you can afford it, then keep the system you have with the employer providing it. But if you are a small business person that has no health insurance, then you've got $5,000. You've got $5,000 to go out and invest in health insurance. So there's going to be this great debate across this country. And the problem has been exacerbated, as you know, very dramatically because of our faltering economy. Every time that someone loses a job, we have another burden on our healthcare system. Every time that our economy worsens and healthcare costs go up, then the challenge is greater. And there is a direct connection between the healthcare crisis in America and the economic situation in America, and they are not disconnected. So we've got to go all over America. We've got to have this debate. I've probably talked too long, but I wanted to give you my ideas and thoughts before I listen to your ideas and thoughts, and I'm sure that many of the ideas and thoughts that I have from you will be helpful in this discussion. So since I didn't recognize you as a member of Divided We Fail, then you will be the first to make a comment or a question. Thank you very much.
Plan worked out. Okay. Thank you. And thank you very much for your support of the Divided We Fail platform. We've appreciated it all over the nation, and we have been there with you. I had to write it down. I'm not as good at this as you are. How does your plan help those who can't afford insurance and have been turned down by insurance companies?
Thank you for the question, because that's a vital part of this problem, and I should have talked about it before. The quote, uninsurables, pre-existing condition, chronic disease, and we're going to have what we call a GAP, Guaranteed Access Plan. Right now, there are 20 states that have sort of approached this problem. They put a lid on the increase in premiums and tried to establish risk pools to spread the expenses of these individuals. In Florida, the governor of Florida has a proposal called Florida Cover Florida, where the states are starting to work together, either alone or together, to provide basically a pool of funds which will then allow them spreading that risk pool as widely as possible, and perhaps putting in incentives for insurance companies to specialize in caring for these particular individuals that are, quote, uninsurables and chronic disease or pre-existing condition. So I'm going to work with the governors and the legislators and the patients, and we will sit down and we will find out a way with a federal contribution. There will have to be straight talk, there will have to be a federal contribution so we can together in shared expenses establish, and they may vary from state to state because, as you know, with conditions and insurance rates and everything they're different in New York City than they are in Fargo and in Sioux City and Des Moines, as you know. So, but we have to commit to an agreement as soon as possible between governors, legislators, the federal government, and address the issue of these individuals. They cannot be left behind. And the worst situation of all, of course, is when they end up in the emergency room and get neither the quality nor the continuum of care that all American citizens should be provided with. Now, the blowback I've got, well, you don't have a specific plan for it. I've got the outlines of a plan, and I've had conversations with many of the governors. They are eager, because they realize their obligations too. They are eager to sit down, and it's a matter of working out the details, because we have the principles. We have the principles. And I'm confident that we can do that. And I apologize for not bringing that into the beginning of our conversation.